So we're still talking about the amoxicillin trihydrate potassium clavulanate or amoxicillin clavulanate. So we move on to the interactions. So concomitant or co-administration with probenecid is not recommended. Okay. So as probenecid decreases the renal tubular secretion of amoxicillin, and concomitant use with the drug may result in increased and also a lengthening or a prolonged increase in the blood levels of amoxicillin, but not of clavulanate. And using amoxicillin clavulanate together with allopurinol during treatment with amoxicillin can increase the chances of allergic skin reactions. And together with other antibiotics, such as just as with other antibiotics, amoxicillin clavulanate may affect the gut flora, leading to lower estrogen reabsorption and reduced efficacy of combined oral contraceptive pills. And it's mentioned in the literature that there are uncommon or rare cases of increased INR in patients who are on acinocumarol or warfarin and then prescribed a course of amoxicillin. So if there is a necessity to give amoxicillin clavulanate together with warfarin, etc., then the PT, the prothrombin time, or the international normalized ratio INR should be carefully monitored with the addition or withdrawal of the drug. And in patients receiving mycophenolate mofetil, it has been shown that there is a reduction in pre-dose concentration of the active metabolite mycophenolic acid of about 50% after the starting of oral amoxicillin plus clavulanic acid. However, the change in the pre-dose level may not be an accurate representation of the changes in the overall MPA score. In animal studies, reproductive studies in mice and rats with oral and parenterally administered drug of this with the oral and the parenteral administration of this drug, there has been no teratogenic effects seen. And in a single study in preterm, in mothers with PPROM, which is preterm premature rupture of membrane, it was shown that treatment with the drug augmentin prophylactically may be associated with an increased risk of necrotizing enterocolitis in neonates. Okay, as with all medicines, not as with all medicines, as with many medicines, or as with most medicines, this drug should be avoided in pregnancy, especially during the first trimester, okay, unless advised by the physician. And this drug may be administered during the period of lactation, and there are no detrimental effects for the infants except for the risk of sensitization due to the associated with the excretion of very trace quantities of the drug in breast milk. So this drug might get into the breast milk, okay, in very, very small quantities. So this before that, how about the effects of the drug on the ability to drive and use machines? They have not been observed. We have not observed any adverse effects on one's ability to drive or operate machines when taking the drug. So adverse reactions. So with regards to the adverse reactions, so when we say very common, that means it's more than 1 in 10. Common is more than 1 in 100, but less than 1 in 10. Uncommon is more than 1 in 1000 and less than 1 in 100. Rare is more than 1 in 10,000 and less than 1 in 1,000. And very rare means less than 1 in 1,000. So very rare includes 1 in 100,000 or 1 in 12,000, 1 in, yeah. So those are the terminologies. So what are the adverse reactions or adverse unwanted effects with this drug? Okay, firstly, infections and infestations. So we have So we have mucocutaneous candidiasis, which is considered common. And then blood and lymphatic system disorders. Very rarely we might develop reversible leukopenia and thrombocytopenia. Okay. Very rarely you might develop reversible agranulocytosis and hemolytic anemia, and also see prolongation of the bleeding time and prothrombin time. So with regards to the immune system disorders, very rarely you might see antineurotic edema, anaphylaxis, serum sickness-like syndrome, hypersensitivity, vasculitis. Okay, and then the next system is the nervous system disorders, CNS. Uncommonly, you might see dizziness and headache. And very rarely, some patients develop reversible hyperactivity and convulsions. And convulsions may occur in patients with impaired renal function or in those receiving high doses. Next system is GI disorders. So adults, very commonly diarrhea, commonly nausea and vomiting. So in children, diarrhea, nausea and vomiting are all common in children. So in all populations, nausea is more frequently associated with higher oral dosages. So if there are GI reactions, then that can be reduced by taking the drug at the start of a meal. Okay, at the start of a meal. So uncommonly you might see indigestion. Okay, these are in all populations. So you might see indigestion. Very rare, uncommonly indigestion. Very rarely antibiotic associated colitis, including pseudomembranous colitis and hemorrhagic colitis. And very rarely you might develop a black hairy tongue because of taking amoxicillin clavulanate. For hepatobiliary disorders, uncommonly you see a moderate rise in the AST and or ALT, okay, in patients treated with beta-lactam antibiotics. Very rarely you can see hepatitis and cholestatic jaundice, okay, which have been noted with other penicillins and cephalosporins too. Hepatic events have been reported mainly in males and elderly patients, and this may be associated with prolonged treatment. And fortunately, these events have been rarely reported in children. The signs and symptoms usually happen during the treatment or shortly after treatment, but in some cases may not become clear until several weeks after the treatment has ceased, and these are usually reversible. Hepatic events, liver events may be severe, and very rarely, extremely rarely, deaths have been reported. And these usually are associated with patients, or have occurred almost always in patients with serious underlying disease, or our patients taking concomitant medications that are known to have the risk of causing hepatic effects. Okay, skin and subcutaneous tissue disorders. So these ones are either uncommon, rare, or very rare. Okay, so uncommon ones: skin rash, pruritus, urticaria. Rare, erythema multiforme. Very rare, Stevens-Johnson syndrome, TEN, bullous exfoliative dermatitis, acute generalized exanthematous pustulosis, AGEP. So if any hypersensitivity dermatitis reaction, if you see one, then treatment of amoxicillin clavulanate should obviously be discontinued. And then the next system is the renal and urinary disorders. So this is very rare to see interstitial nephritis and also crystalluria. In overdosed, GI symptoms and also disturbance of the fluid and electrolyte balances may be clear. So you might see, besides the GI symptoms, you can see electrolyte abnormalities. So GI symptoms may be treated symptomatically with attention to the water electrolyte balance. Mainly you have to stabilize the patient, the electrolytes, normalize it. And also amoxicillin crystalluria has been observed, and this in some cases may lead to renal failure, and this drug can be removed from the circulation by doing hemodialysis. Okay, this will continue in the next video. Thank you.